Now, and I'm very excited to welcome everyone to today's webinar. Thank you for joining the CDTRP's Level Up webinar series today. My name is Chloe Wong-Mercero. I'm a CDTRP trainee, member of Theme 1, Improve a Culture of Donation. A culture of donation, yeah. And I'm a graduate research student at the University of Toronto under the supervision of Dr. Suze Burkhout and Dr. Kelly Fritsch. And our research takes a more qualitative and arts-based method approach to understanding the psychosocial support needs and the experience of long-term liver survivorship within solid organ transplant recipients. So I'm really interested and excited to be facilitating today's webinar, and especially because we're interested in patient engagement at all levels of research. And so before we get started, I wanted to recognize that although this webinar is virtual, it's important for each of us to reflect and acknowledge the lands that we're tuning in from. So I'm currently on the unceded lands of what is commonly known as Montreal, or the traditional name Jojage of the Ganyan-Kahaga peoples and the Haudenosaunee Confederacy. And the University of Alberta hosts the CDTRP, and we respectfully acknowledge that they are located on the Treaty 6 territory, respect the histories, language, and culture of First Nations, Métis, Inuit, and all First Peoples of Canada, whose presence continues to enrich our vibrant communities. So I encourage you to all reflect on and create your own land acknowledgements. You might want to introduce yourselves in the chat and include those acknowledgements in the chat box below. And so today's CDTRP webinar, on behalf of the team, I'm excited to welcome Dr. Dawn Richards and Linda Hunter, who are presenting on the topic Co-Creating Patient Engagement in Research Training Modules, Our Journey Together and Where We Traveled. So a few housekeeping notes before I introduce the larger team. Today's webinar and discussion are being recorded and will be posted on the CDTRP's website and their YouTube channel. So during the presentations, we kindly request that you turn off your cameras and mics. And once the presentations are complete, we ask that you turn on your cameras if you are comfortable for the Q&A period. So if you have a question or comment, please raise your hand using the Zoom function to ask our presenters directly. You can also privately send a message to me if you'd prefer to keep your question anonymous, and then I will read out your question during the Q&A period. So now it's my pleasure to introduce the team. So Linda Hunter is a retired executive healthcare leader and a nurse who has worked locally, nationally, and internationally in the healthcare for over the last 35 years. She has spinal stenosis, osteoarthritis, and severe degenerative disc disease, and has lived with chronic pain for over 10 years. Linda is a CIHR Patient Engagement Research Ambassador for the Institute of Musculoskeletal Health and Arthritis, and is a member of the Institute's advisory board. Linda states, "It is vital that the patient voice is respected, listened to, and incorporated into change in the delivery of healthcare services, including research. Patients are experts in their disease and their lived experience. They are becoming more informed and knowledgeable, and it is imperative that they are included in the development of plans of what is research." Next, we have Dr. Dawn Richards. Dawn Richards is a PhD and founder of the 502 Labs Inc. Her firm provides traditional services, including project management and preparation of grants, manuscripts, corporate and lay language materials, along with those to incorporate the patient perspective and through the development of relationships with patients and patient organizations. With a PhD in Analytical Chemistry from the University of Alberta, Dawn has worked in a variety of roles over 20 years, but it's her diagnosis with rheumatoid arthritis in 2006 that instigated a journey to intertwine her passion for science with making the most of her diagnosis. Dr. Richards is Vice President of the Canadian Arthritis Patient Alliance and a CAHR IMHA Patient Engagement Research Ambassador. And so thank you both for joining us today. Linda and Don, I'll pass it on to you to get started on the presentation.
Thanks very much. And thanks everyone for having Linda and myself here today. It's really our pleasure to share the next 50 or so minutes with you. And I'm just going to bring up my slides as a starter. Okay, so as Chloe mentioned, we are here to share with you our experiences in developing a how-to guide for patient engagement in research. And this is about our journey together and where we've traveled. So Chloe already gave a really nice intro of myself, and I think Linda's probably good with her bio also. Linda and I are both active on Twitter as well. So for what it's worth, and as long as Twitter lasts, these are our Twitter handles, and just feel free to share anything from the session today that you'd like to via Twitter if you're on there, or any other places too. Linda, was there anything else that you wanted to add here as we introduce ourselves? You're good? Okay, great. So today's presentation, we're going to try and keep the acronyms to a minimum, but you'll see some of those acronyms here. We will talk a little bit about CIHR, or the Canadian Institutes of Health Research. We'll talk specifically about the institute that Linda and I are both affiliated with. So you'll hear me affectionately call it IMHA, and that is the Institute of Musculoskeletal Health and Arthritis. We'll talk today about the Patient Engagement Research Ambassadors team that Linda and I are both members of. We'll give you kind of a behind the scenes tour of how we've developed these patient engagement in research modules. And Linda's going to give you a great overview of what to expect as a learner going through the modules. And then lastly, we'll share some learner feedback with you, and we'd invite you, if you do choose to go into the modules and work through them, we are open to any and all feedback. And I can tell you that we take it really seriously. And we've heard that there have been a few challenges for some individuals in terms of logging into the modules, and we're working as furiously as we can to fix that and make it a good experience for learners. So for those of you who may not be as familiar with CIHR as others, CIHR is Canada's federal funding agency for health research. It's composed of 13 institutes, so IMHA is one of those institutes. Most of the institutes focus on kind of a disease area or body part. I know that kind of distills it to the most basic, but they do. And CIHR collaborates with partners and researchers with the ultimate goal of their research being to improve the health of people who live in Canada and to strengthen our healthcare system. So if you don't know too much about CIHR, there's a link here, and we can share the slides and the links after the session as well, if that's helpful for people. So as I mentioned, Linda and I are here on behalf of the Institute of Musculoskeletal Health and Arthritis, or IMHA, one of these 13 institutes under CIHR. And as you can imagine, this is the hub for all things at CIHR related to musculoskeletal conditions, skin and oral health research. So this is actually one of the institutes that has like a really quite a broad mandate. In terms of arthritis alone, there are over 100 different types of arthritis. So throw that in with skin conditions, dental and oral health, and this takes up quite a large research space. And this particular institute has quite a long history of actively encouraging its research community, as well as itself incorporating patient engagement into the institute. I'm really happy to see some of the other institutes picking this up in terms of patient and community engagement. but we can proudly say that IMHA was really 20 years ago one of the first institutes to do so. So just briefly to point out that the work that IMHA is doing around these patient engagement training modules is really aligned with both CIHR's strategic plan as well as IMHA's strategic plan. And IMHA really, as part of its strategy, wants to authentically engage people with lived experience in terms of its research, as well as activities of the Institute itself, which you'll see here today. Lastly, I just want to make sure that we're on the same page in terms of some of the definitions that Linda and I will use. And obviously, for the purposes of this webinar, we'll use CIHR's definitions. So, you might call patients people with lived experience, or people with lived and living experience, or maybe there's other terms. We're going to stick to patient for the webinar's sake. And CIHR quite broadly defines this as being what they call an overarching term that includes people with a personal experience of a health issue, so like Linda and myself, as well as informal caregivers. So that might be our spouses or partners, that might be our family, that might be our friends who are also affected by our conditions. So all of those perspectives under the CIHR umbrella are considered to be patient perspectives. And CIHR also has a specific definition for patient engagement. And here they deem that meaningful and active collaboration. So not just a checkbox, not just a name on a website, but meaningful and active collaboration throughout the research process. So that could include governance, could include priority setting, it might include actually doing the research, in disseminating the results of that research. And again, it may also include bringing in the collective voice of specific communities. So not just individual patients, but beyond individual patients. So those are just a couple of terms to bring everyone onto the same page. And then before I pass it over to Linda, I'll just introduce you to IMHA's Patient Engagement Research Ambassadors. And you'll see this abbreviated as PERA, P-E-R-A throughout. And so this is an evolution of the Institute engaging with patients. That started back in 2003, so 2 decades ago, under the direction of Dr. Cy Frank at the University of Calgary, who at the time was the scientific director of IMHA. And the idea behind engaging patient engagement research ambassadors is to bring in people who live with conditions that fall under IMHA's broad umbrella mandate, and to work with those individuals who provide unique lived experiences to help IMHA overall achieve its goals and priorities. So that's kind of some context setting for you about CIHR, about the institute that Linda and I are affiliated with, and about specifically the patient engagement research ambassadors work that we'll share with you today. So over to you, Linda.
Perfect. Thanks so much, Dawn, and thank you everyone for attending. We're really pleased to be able to share, and we're quite proud of our work too. So our PERA peers are quite diverse. We've all been involved together for over 2 years now. Eileen is a young single mother who has rheumatoid arthritis. She lives in BC. She's a social media genius and does excellent work in really spreading the word from expertise of a person living with chronic conditions. Trudy Flynn represents the Maritimes. She's also a retired nurse. She's an avid runner and marathoner. She suffers from fibromyalgia, and she is the chair of FAC, which is a Fibromyalgia Association of Canada, and set that up with her peers. Jillian is a social worker. She has a master's degree. She's also from Ontario, and she works in the healthcare field, helping those living with dementia kind of navigate their life and go through the continuum of care as they need care. Sabrina Poirier, who is also on the East Coast. She was a PERA and a very active member. She has since moved on, and she does a lot of work with CIHR and represents those living with myalgic encephalitis, which some people know as chronic fatigue syndrome. And she also works with a whole bunch of long COVID groups. Alan Storty represents the Prairie Provinces. He's from Alberta. He's CEO of a human resource firm, and he lives with psoriasis and also psoriasis arthritis associated challenges. Christine Thomas, wonderful lady, has osteoporosis. Shortly after her child was born a few decades ago, she fractured bones just in lifting her child up. And recently, about a year ago, she fell and fractured some more bones and had to have a spinal fusion. She's written a few books of authorship. So you can see we're a diverse group. We recently put out a call, AMHA put out a call for new members, and we'll be welcoming new members in January moving forward. And we do a 2-year, sometimes going to 3-year rotation as PERA members. So moving forward, really our mandate is what inspires us to move forward with a lot of work we do. We're all driving this from first-hand experience of living with diverse conditions. And even if we all aren't healthcare professionals, we have all dealt with the healthcare world throughout our experiences. So we're really trying to inform the research institutes and CIHR of patient priorities from our own perspective. We want to inform communities like yours and other communities that we speak with and communities of practice about what we do and the work that we're creating. We really advocate to benchmark best practices and want to bring best practices into action. So whatever we really see, whether it's about tokenism as a patient partner, whether it's paying patient partners, we want to know what's out there, understand the research, and also include the research and what we can do and then share with you. We want to curate quality patient-oriented research assets, and this would be probably a deliverable that we're going to be sharing with you that we've done. And we work very actively to evaluate the work as we move forward. Process leads to outcome, and we evaluate the process from the perspective of the Institute Advisory Board, AMHA staff, as well as PERA members, and also you as people that will be using some of our tools. Recently, Christine has done with Dawn a few other kind of cross-Canada and international presentations, sharing our modules with the UK audience, for example. And really, Christine always believes that taking everyone together is really going to make everything so much better. So the whole is truly greater than the sum of the parts. And we all bring different expertises. We also bring different lived experience. So taking what we are experts in and taking what we have lived with and what we really need is what is pushing us forward. Trudy believes that education is key. And I think through education and our lived experience is what makes these very practical modules so real to people using them. Dawn, over to you.
Thanks, Linda. So I'm going to walk you through a bit of a timeline in terms of how at PERA, patient partners really set the priority to develop these patient engagement and research modules. So as Linda mentioned, the group has been working together for over 2 years now. So the group was convened close to the start of the pandemic. We as a group have never met in person. We've only met virtually over these 2.5+ years. So the group was convened back in May 2020. And throughout the summer of 2020, we had a series of meetings. We had one meeting per month for a couple of hours. And what we did there, the goal was to identify as a group what people felt were gaps in patient engagement and research. And we didn't do this by sitting down and saying, okay, what are the gaps? We actually went through this process where we got to know each other, we shared information, we helped the group build capacity. People had different levels of knowledge about research, about the Institute, about CIHR, their own work in patient engagement. So we had some guest speakers, we had some members talk about their own experiences. And from this, at the end of the summer, we just through those conversations ended up with actually what we called a parking lot. And the parking lot was full of ideas where we could actually strengthen, or what we felt could strengthen, resources related to patient engagement in research. And from that parking lot, we put together how aligned those were with the Institute's strategic plan. What might the outcomes be associated with each of those ideas? And the group really decided that its main priority would be to develop what we're talking to you about today. So the end of a 2+ year journey is these patient engagement in research modules. So between the fall of 2020 and spring 2022, our nearly monthly meetings were really focused on developing the content and curriculum for these modules. And then we started to release them actually over the summer, kind of one by one as they were completed and ready to go. And then formally, we did a hard launch of the modules starting in, I think it was late September, early October. And that's part of what Linda and I are doing with you here today, is helping you understand the process for creating these modules and sharing with you what the modules are all about and how you might be able to use them in your own work. What Linda and I are going to talk through with you today can also be found in a blog. So we've got kind of multiple ways for people to learn about this experience and to learn more about the modules. So I can click into the chat this particular URL, but basically the group has written a blog on this journey together and the modules as well, which is found on IMHA's patient engagement blog. So back to you, Linda.
Thanks, Dawn. We really wanted to take all our aims and put them into action. And what we're going to see is the action became the modules. The modules and the patient engagement training is really for quite a diverse group of people. It's for patient partners, and you saw that patient partners is a fairly diverse group and can include family, caregivers, and friends. It's for researchers as well as trainees and other students, certainly clinicians and other people that are taking courses in the healthcare world, but they might not be clinicians, and even other members of the research team. What comes to mind is those who are doing administrative work, research coordinators, or people that are organizing aspects related to research. When we talk about clinicians, we're speaking to all clinicians, whether you're a physician, a nurse, a pharmacist, social worker, it really doesn't matter. It's quite a generalizable to different key stakeholder groups. What's really key, though, is the how-to guide for patient engagement in research is not disease or condition specific. It doesn't matter what you're researching, and it doesn't matter what someone is living with. It's really applicable to any space where research and patients intertwine and patients are engaged in research. So, what do you expect as a new learner? We wanted to make sure that this was a real accessible program, and accessibility was a priority for us and was an outcome for us. So we wanted it to be openly accessible. We wanted it to be free. No one had to pay any money for it. It is asynchronous. You can take it at the time and at the pace that's most comfortable for you. You do not have to complete all 4 modules at the same time. Someone can turn off narration whenever they want it off, or they can have it on, or they can just see the words in the bottom. It's bilingual. It's in both official languages, all 4 modules. And learners receive a certificate at the completion of each module, but they also receive one at the completion of the whole course. And we'd really love over time to see this become, mandatory in certain spaces, and we're certainly seeing some interest for that. We wanted to look at this through an open science lens and really say that the future of patient engagement in the research landscape is kind of part of this. So how do you go to get into the modules, and how do you access the how-to guide for patient engagement in research? You go on to our webpage in EMHA, you go under patient engagement, and you go to training. And then there's a navigation tool that will have some information and explaining that. I think, Dawn, you're just going to show a little bit here. Some people that have been using the learning module system have been speaking to us and letting us know that they had a few challenges. So Dawn will just take you through a little bit of information so it's really clear on knowing what to do.
Yep, our two kind of big tips here, and just so that people know, we're just in the process of updating the website so that it really walks people through the login process and in case there are any issues for them. So number one is remember your login email and password. We're having people forget which email they use, so it's important for you to remember that. The second thing is that this might be counterintuitive, but the organization that you by default should be in the LMS when you do sign up is IMHA. And that's so that the learning management system knows which modules you're going to, and also for the purposes of billing, which doesn't concern you at all, but they know how many people are associated with IMHA. So a bit counterintuitive because we're having people put in their own organizations, and we're just making that much more obvious. And that's part of why we've added that to our presentation as well.
Thanks, Dawn. I guess we could also say, speaking as patients, sometimes as patients with the different disease processes we do have, your brain can get a little foggy and you can forget some just very simple information. So based on feedback that came from patients and other partners, we wanted to make it as easy as possible. So an overview of the course, there are 4 modules. 2 of the modules are subdivided in that one part of the module is designed for patient partners, and then the other part of the module is same thing, but it's designed from a perspective for all other members of the research team. So the first module is really a basic introduction to patient engagement and research. You know, what is it? Why do we do it? How do we do it, etc., to give a flavor of a foundation before we move on to understanding the research process. The first module, part A, I guess, of 2, is designed from a patient perspective, really going over the different parts of the research process in case they don't know about that. And then from the research team, it's understanding how to support patient partners throughout the research process. Research teams are very, very comfortable with patient partners as subjects or participants, let's say, in their research. This is really looking at it from the get-go and supporting the patient partners throughout. Module 3 is all about setting up a research project for successful partnership. Some of the key takeaways there are how to lead, how to have a meeting, how to ensure that there's a respectful environment. What about aspects related to tokenism and making sure that everyone's heard? And there's some real great links and downloads in that part that people have let us know vis-a-vis template for terms of reference and tips for meeting agendas, etc. The last part, module 4, is being part of a research team, and it's designed from a patient partner. What can you expect when you're part of that team? And then the other one is designed for all other members of the research team. But how do you engage and make use of the expertise you have on the team with the patient partners? All the modules are anywhere between, depending on how fast you go through them, about 20 to 40 minutes maximum. So I'll just go through the modules, you know, a little bit more in depth up for the next few slides. The first one, the audience is patient partners, all members of the teams, as we indicated, and we're really looking at identifying foundational concepts and guiding principles that are used to describe patient engagement in research. A lot of this comes from best practices and gold standards in this area, and we want to show some potential solutions to challenges that might come up in patient engagement in research, and that can be unequal powers, how people feel, who has a voice, who's included. So just aspects and helpful tips on how to bring the best out for everyone. Moving on to module 2 is probably one that you would all be quite comfortable with from your own perspective, but we want to make sure that the audience of patient partners understands the research process just as well. So we want to talk about basic concepts about research, the research cycle, how it's done, who does it, where do ideas come from, and how do you kind of gravitate them through that cycle. And also more about understanding how research is funded. So we look at the cycle of identifying problems, gathering the information, setting objectives, how to do such, developing plans together as a team, seeking feedback, actually doing the research, and then where do you take that? How do you share the results? How do you apply it? How do you evaluate it and move forward? From the non-patient partner side, all other members of the team, we want them to know how to support patient partners through the research process. So what the objectives that we have defined is identify what research looks like with patient partners. People that have done it and have done it well, know what it's like and know what works. People that haven't done it, it's really quite different working with this collection of experts called patient partners. And we want to show the reality of the challenges, but also ways to help people forward with that. So how do you support truly patient partners who are in your team? We then move on to setting up a research project for successful partnerships, because that's what we all want. We all want success as we move through. So the audience is everyone together, and we really want people to understand the steps to set up a successful research project where the patient engagement is supported. How do you actively seek it and how do you bring it forward? And identify resources to support patient engagement and research process. Some of the aspects that come up here are really what works, what doesn't. When things don't work, what do you do? How do you facilitate? What if issues come up and people aren't feeling comfortable and you know that there's something not quite right, but you're not sure how to move forward with it? How do you advocate yourself as a patient partner on this team where you might see or might think that people seem more powerful than you are? And how do you speak up to ensure that things go a little bit more successfully? So those are some of the tips that we go through. We then move into module 4, and that's being part of the research team. And some of the aspects are really practical aspects of being on the team. You know, who do you link with? When are the meeting times? Do they fit your schedule? What if you're a patient partner living with chronic pain and you're fatigued every day? How does that fit into the aspect of being the part of the team? How do you like to receive information? So identifying resources and key points of contact for people is part of that. We want to make sure when you're engaging patients in the research team as members of the research team that aren't patient partners, that they understand practical aspects of being part of a team that engages patients, because there's a different flavor to the team meeting when you have someone on that has lived experience in real life. And then identify resources and how to set the tone to make sure that everyone's well-being is kind of listened to. So that's a high-level overview of the 4 modules. 4 modules that become 6 because of the way we split it. We're always listening to feedback from them. Isabel Jordan's an excellent patient partner who's very, very active in Twitter, and she just thought that this was fantastic. She'll be sharing it and using it and putting it forward as well. Janet, the same thing, lives with arthritis and some other diseases, and she thought the terms of reference was very helpful to her and some of the work that she was doing in advocacy, and the first meeting guides, which is kind of like a tick-off tool to make sure things are prepared. But anyone can, after they take it, send us feedback at the MHA noted here, or they can tweet it to @CIHR_MHA.
Thanks, Linda. And just to wrap things up, Linda and I are happy to take any questions or hear about any comments you have. Like Linda mentioned, you can feel free to reach out to the general IMHA inbox, which is highlighted here. I'm also happy if people would like to contact me if that's helpful. And then this just has some of the URLs for things. So it's got the webpage and resources. So in addition to the patient engagement training work, we've got other practical resources that might help you. We've also got a little promo video. So if you have to convince anyone about what the modules are about, you can use the promo module or the video. And then, as I mentioned earlier, in addition to this session, we've also written a blog if that's more useful for folks too. So I'm really happy for Linda and I to take some questions or hear anything you'd like to chat about next. So thanks very much for your attention, everyone.
Thank you both, Dr. Dawn Richards and Linda Hunter. Thank you. This is a really exciting project, and I think, at least from my perspective as kind of a research trainee interested in patient engagement and how to do that, and especially in transplant medicine, and how to include patient perspectives. And from a qualitative side, I think we definitely have been seeing how important it is. And the more folks we connect with, the more we see how they want to be involved in this discussion. So it's great to see that there's kind of these training modules to help support recipients and patient partners in research, because research can be daunting. I think it's hard to figure out how to get involved, or to get over that barrier, the initial barriers. And I think, yeah, I can start off maybe the discussion by asking maybe a bit about how, what kinds of barriers you guys encountered, or as you were kind of developing the modules, and what did you hear from other patient perspectives in terms of barriers and burdens to participating in research? Maybe you could speak a little bit to that first. Yeah.
Linda, would you like to start, or would you like me to?
Sure, I can kind of kick it off here from some of my perspectives, Dawn. That's great.
Sure.
And Chloe, thanks for the question. And I'm glad you're a qualitative researcher. I did my master's in qualitative Indigenous health too. So it's really important to kind of branch those two together. Some of it, some of the challenges are, you're asked to be on something, you're asked to be part of research, you're asked to blue sky some ideas and everything, but you're not always really listened to. So you're kind of there because they have to have someone there. So you're not accepted maybe as a full member of the team. And there might be a little bit of that feeling of tokenism. I'm only here because, it's kind of required. I'd say the second thing, and I really appreciate what you said, research can be daunting and everything. I think it can also be daunting for people that are not people with lived experience of whatever disease process. As researchers, having a patient partner with them from the get-go through that engagement, and they don't really quite know what to expect, what to do to this person. And sometimes as patients, we're kind of reduced to our disease process and not always thinking about the aspect of the lived experience beyond that personal lived experience, what expertise we bring, whether it's in strategy, operations in different fields, etc. And I think that's a real strong part of what Dawn mentioned, is ensuring when you have patient partners, know who they are as a whole person, not just as an individual representing a subset of a disease. So those are two things that come to mind. Dawn will have more, I'm sure, from her perspective as well.
Yep. Thanks, Linda. I think those are really good points. I think a couple of other things we also talk about in the modules, Chloe, is we do talk about this concept of power imbalance. And I think many times people just don't know the label for it, but you come in as a patient partner feeling like, you've been invited to this place where everybody else knows what they're talking about. And maybe you don't quite know much about research, or you're new to it. And that doesn't mean you don't have anything to offer. So we do talk about, putting a name to some of those things. And the same goes to tokenism. I think many patient partners and researchers don't know what it is, and certainly don't intend for it to happen. And so we try and walk people through what it actually is and how you don't want to get there, and here are some things you can do to avoid those. I think also we just talk generally about the practicalities of engaging patients as research partners. So our second module really walks patient partners through the research process. It talks about even something as simple, Chloe, as you said, you're a trainee. I don't know that my mom would know what a trainee is, right? Somebody else on this call might say, I'm a postdoc. Again, my mom would have no idea what postdoc means, right? So we talk about some of those things. We talk about how research is funded, which for people in academia, it's like, yeah, I applied for a grant. Again, for people outside of academia, it's like, what? Like, they know somebody probably funds your research, but that whole process is, not something you're used to. So we go through things from just a really practical perspective of the knowledge that we try to provide people with. And then also on the other side, as researchers, as trainees, as clinicians engaging patient partners, again, I think people mean really well, but if you're engaging someone and you're talking terms or you're talking about, the grant application, it's like, they don't even know what you're talking about, right? That like a letter, I need your letter of support, I need your CV. I don't know what that even means, right? And oh, I need it by tomorrow because that's our deadline. So we just walk through some of those things, which are really intended to show people that, well, you're meeting well, and while you talk that talk every day, the person that you're engaging might not necessarily be as familiar with that. We also really bluntly talk about when things go wrong or when you feel like you can't engage as a patient partner, and when you've tried things. And say for research teams, right? We have to be open and honest that sometimes teams and partnerships don't work. And that doesn't mean that they failed. You try your best to correct for things, but sometimes, it still doesn't work. So I think that part is fairly unique because I think we tend to focus on all the good stuff around patient engagement. And we do it a disservice if we don't talk about these challenges, as you've just mentioned. And some of them are big, hairy challenges, just to be really honest with you.
Definitely amazing. Thank you so much. We have a question in the chat too, which is and from another trainee. So they're asking, if a trainee is interested in developing his or her project with patient partners, how do those initial steps look like? Yeah.
That's a great question. Linda, do you want me to start off or would you like to?
I'll let you go in a sec. The one thing I'll say that about this question, I read it as, we're finishing off talking here. Patient partners and researchers do not know where to go to find the people that are going to be patient partners from the beginning of their research. There's no holy list, like across the country that says, oh, you want someone with this? Here's where you go. People are trying to put such things together, and people that do advocacy work like ourselves and work in the patient engagement field know a lot of contacts and where to start and where to move forward. But I would say this is not just a trainee or researcher interest question. This is also a patient partner question and how to make those two meet. So excellent. But Don, I'll let you go forward with some of your reasons or answers.
Yeah, I think there's a couple of things here. I think we could talk about this for a long time, but I think a couple of things here would be, it might be good for you to explore with people that have engaged patients as partners, and just to talk about what that looked like, and what kind of time maybe needed to go into it, what kind of supports maybe needed to go into it. Obviously, I think it's something important to talk to your supervisor about. Maybe they have some experience in this area, and just to know that they're supportive of that, and you taking on that direction, which I think is great. And then I think, like Linda said, it's not just about finding patient partners, but it's doing a bit of homework too on why you would like to do that, how you think you might engage them, even though that might change once you bring them on. But I do think it is being thoughtful about those kind of, who, what, where, when, why, how type questions, and think about what those things might look like. So I encourage you to do it. I think it's great. I think just put some thought into it, use some of the resources that you might have handy, and happy to give you some other advice once you've decided that's what you'd like to do and you're on the search for patient partners if you need to be. Linda,
I
what
guess,
would you like to
yeah,
add there?
I would just say, like, sometimes a good place to start is with an association of a disease process. There's usually people there that are fairly active in advocacy, patient engagement, working with others, know researchers, etc. And also in different disease processes, there's researchers that have been doing this for a longer period of time, and they kind of have a list of contact names and people to go to. Sometimes, I mean, it's maybe sounds silly, it doesn't to me. Social media, even through Twitter, is a good place to sometimes find those that might be interested. I do agree with Dawn. If you're doing this as a trainee, it's going to be going, you know, through with those with whom you work. So there might be a community health center, there might be an Indigenous aspect of a place where people meet that have a certain, you know, project going on, and you might be able to find some partners there. So because the first step is finding the people, and then there's the process of how do you work with them. And I think Dawn spoke to a lot of things about the process of how you work with people.
And it looks like, Linda, I'm seeing that CDTRP also supports helping individuals find and engage patient partners. So that's great.
Yeah, that's fantastic. I think more and more organizations or associations are going to be starting to do such things because it's such a need, and it's blossoming so much. So it's going to be, I think it's going to be, you know, give 10 years down the line, it's going to be everyone does it in research. It's not like, oh, who does it and who doesn't do it.
Oh yeah, I see Lindsay Thompson has a question, so I'll.
No, it's just more related to finding patient partners. The local provincial SPORE groups are also excellent resources for finding patient partners. At the recent, was it the Western SPORE, the Alberta conference, it was the question that kept coming up continually. How do you find patient partners? And like patient partners, we directed these people to, like you say, the mother groups. Who are the national groups? The provincial health services all have their volunteer groups that cover a complete range of healthcare, like with diseases, with policy. You know, it's just you'll find them.
Yep, that's a great point, Lindsay. We've got within the modules too, we've got other information where people might look when they're ready to engage a patient partner. So as Linda mentioned, we talk about patient organizations, health charities, research networks. We talk about the SPORE support units across the country. And to Linda's point, there's no one place, which makes it tricky, but you should be able to find a person or organization to help you if you need to.
And even places like Health Excellence Canada, HEC, that took the amalgamation of Canadian Patient Safety Institute and Canadian Foundation for Healthcare Improvement, Accreditation Canada, if you're working with healthcare organizations, have best practices in, you know, some of these areas, and they will know people who know people, and it's really getting a community of people through the networking process.
Yeah, amazing. Are there any other questions from the audience?
Sure, I can quickly jump in. One more of a comment just to say, you know, going through your presentation, like I really loved the focus that you had on one. It seems like it was a very iterative process with your patient ambassadors, with the focus on capacity building and just that information that I think is so critical for both patient partners and researchers to know when it comes to patient engagement. I'm not sure whether it was Linda or Dawn who said it, but you know, the who, what, where, why. You know, I think by having that capacity building component, it really gets away from tokenistic partnerships, right? Where you're not just checking off a box to say, yeah, I have a patient partner involved, but you're really thinking about why, you know, you're getting patients involved and how they're going to be supporting. My one question I did have, and I'm not sure whether the modules go through this. One of the things, some CDTRP's patient family donor partnerships manager, part of my role is connecting partners with researchers. And I have a process as to the information that I need from the PIs when they're looking for patient partners, right? To get away from that tokenistic. So I require time commitment, what the summary's about, like what the project's about, what the inclusion criteria is going to be. So if it's something for kidney patients, then you should have experience with patients, kidneys. So my question is, from the work that you've done, like, do you have a guiding document, or do you have, I guess, just suggestions on what patients, both patients and researchers, need to find that, call it, ideal match? So if I'm a patient partner and I want to know X, Y, and Z, really, and then yeah, like, I guess I'll just pause there. Like, did that come about in your work?
Yeah, I'm trying to think here, Linda. We don't have kind of like that checklist manual, but we do have in one of the modules, I think it might be module 3, we've got, for example, like a templated terms of reference, which might be a little bit different from, a committee's terms of reference, but it does have things in it in terms of like, how much time would you expect your patient partner, or as a patient partner, how much time do you have to be part of a research team? It talks about the supports for that. Like, for some patient partners, compensation is really important for them to be able to engage. For other individuals, it's like, I'd rather do this as a volunteer. And, for researchers, do you have the budget if somebody really needs compensation, or at the very least needs expenses paid for in some capacity? So we've got some of those in terms of like determining, is this kind of going to work for you, and the types of considerations that you might think about as you enter a partnership. Not quite what, it sounds like your process is like, what you've refined for your needs, but we do get people to at least think about, what's going to work in terms of an engagement, what's not really important for them, and maybe things that they haven't thought about that could be really important to either the researcher they're engaging or to them as patient partners. Linda, would you like to add to that?
Yeah, just a few things. And it's a very good question, Manuel, because if I'm understanding where it's coming from, first of all, I want to say something about compensation. Don't forget that patient partners that are on disability usually do not want compensation because it has to be subtracted from. So it's not that I don't want the money, money has to be given in other kinds of ways. So that's just one other thing that makes it's not more complex, it's just to have that understanding. It's not always simple. I know patient partners sometimes want to be included up front. So one of the things to think about, no one likes to have more than a full straw dog and the whole plan laid out in front of them. And then this is what we're going to be doing. And oh, Linda's a good patient partner because she fits into this, but I wasn't part of anything in any of the discussions of bringing that together. So it really depends if it's a patient partner from the get-go, including blue skying, prioritization of research, what the objectives are, et cetera, and taking someone through that. And that's a very, very different way of looking at it than looking at a patient partner of something that's already kind of, gone through that process of being something firm that's going to be done. It's still a good thing to be done, but you're coming in at a different place. Different people will want to come in at different places, and patient partners truly engaged in research want to be upfront as part of the whole collective of the team, because then you feel it goes back to some of the power imbalances that Dawn mentioned earlier on. I hope that makes kind of sense or fits a little bit, Manuel, with what you were looking for.
No, yeah, that makes sense. And I saw some hearts as you were talking, Linda. So I think our patient partners on the call appreciated that as well.
Yes.
I know I'm mindful of the time, but I'm very interested in the guide and how things got developed there. And I really like the phrase where you guys spoke to how the guide is not disease specific or condition specific. And I think that's really important because even, kind of there's these silos that develop, I think, in research, the kind of narrowing of research just about transplant, engaging with people with transplant experience, but then kind of, I really like that this guide is non-specific, or I mean, it's specific to patient research, but also general enough that it can be used in multiple different areas of research. So I guess I'm just curious about what that dynamic has been like to bring in people or to be connecting people from various different backgrounds or through through the guides and even from different positions, like, as you said, caregivers perspective, friends and family, research trainees, or even kind of people higher up in their career in research. But yeah, maybe you can speak to that dynamic.
Dawn, I'll just say a few things, and maybe I think it might be good for you to give some information on who has been taking, you know, the modules, etc. You know, it's a great recognition, Chloe, too, because I'd say it's powerful. It's more powerful when people from diverse backgrounds and diverse kind of lenses on something with patient engagement and research kind of are actively understanding it together in a different way. So to me, that builds a greater community, and it builds a community that can do kind of better things together. So I just wanted to say that point. But for example, I'm creating an executive MHA course at the University of Ottawa, and there's a whole week on patient engagement. And the people that take the executive MHA are mid-level executives who are usually VPs or directors in healthcare services across the country. They should know about patient engagement and research. So we're having a mandatory session where they're going to be doing these sessions. That makes it more powerful to have understanding when the fruits of research come to the people that they're taking care of in their clinical settings. But I think maybe giving some examples, Dawn, of the 400 and how many odd people that have kind of signed up might give a flavor too.
Yeah, and just to let you know, Chloe, too, that while IMHA drove the creation, the curriculum, we did have people along the way. That was part of my job, being the project manager, was to have other individuals provide input on the curriculum. Are we missing things? You know, we've got a fairly, not a completely narrow lens, but we wanted to make sure we had researchers put their eyes on it, clinicians, trainees, different perspectives from different communities per se. So we did have that input along the way as well. And then to Linda's point, I was just in the learning management system today. So we've got just over 450 individuals who are taking the course, basically. So there are various stages of the modules. The majority of them are researchers. Then the next largest number is patient partners, followed by trainees, and then what we just call other members of a research team for simplification, right? They might be a research coordinator or a research associate. And then we've got a number of clinicians in there as well. So it is definitely resonating. I'm actually pleased to see it's not patient partners who are the #1 takers of it, because we all know that it's not just patient partners who need training here. It's that many individuals within the research community need some help with this. So I'm really grateful to see that it is reaching a broad audience. They're mostly Canadian, but we do have international individuals taking the course as well. So that's always encouraging to see, even though it's got a bit of Canadian centricity on it, just because of who's funded it. Again, I think that many of the principles and the information that we share within the modules is highly applicable to other settings in other countries. So yeah, and I just wanted to note that I saw Mary's comment. So hi, Mary, it's nice to see you again. And I completely agree. I've also seen where patient partners have been involved early on, or they've identified priorities that the researchers didn't know because they don't live with these conditions all the time. And it's really special when you're part of something like that and you see the research direction change because of something a patient partner has brought to the table. So here's hoping we can galvanize more of that to make sure that research results and outcomes are more meaningful to the people they impact also.
Yeah, absolutely. Thank you for that. I think that the two responses really go well together. I do see we're at 4 p.m., but I'd invite anyone to email Manuel if they have extra comments or questions that you'd like to follow up on. But thank you all for coming today and for your questions and comments. And once again, thank you, Dr. Richards and Linda Hunter, for your amazing presentation. It's been a real pleasure to connect and hear about this important work that you guys are doing.
Thank you so much.
Thanks.
It's been a pleasure.
Yeah,
Take care,
thanks for
guys.
having us. Take care, everyone.